Welcome back in. We are focusing on heart health today by talking with a physician from Cardiovascular Associates. Dr. Barry Rayburn joins us now to talk about heart failure. And I was asking you, this is a common condition.
It is. Congestive heart failure is actually one of the most common cardiovascular conditions in America today. There's about 6 million people who suffer from that, and we're adding new cases at a rate of several hundred thousand per year.
And why? Why is that?
Part of it is we're an aging population. The average age of the population is older, and heart failure is more common the older you get. But also, we are seeing so many successes in other areas that people who formerly died of a heart attack may now survive that heart attack, but later in life come back with heart failure.
Wow. And I'm reading here, it says this is not a disease.
Right. Heart failure is a clinical syndrome. It's a group of symptoms, and it's often the end result of other diseases that affect the heart.
And let's talk more about, you were saying, you know, if you have congestive heart failure, this is not, you know, a death sentence of sorts.
Yeah, that's right. The term is a scary term because the term failure sounds so final.
Like your heart is stopped, you know?
Yeah, exactly. But that's a very old term, actually. Congestive heart failure just means the heart's not keeping up with the needs of your body right now, but treatable, and if it's properly identified, especially early on, we actually have made great strides in bringing this under control.
Which means look out for these symptoms. Talk about those symptoms.
Sure. So your heart is responsible for delivering blood to all the organs of your body and for keeping fluid regulated. So one of the things that we'll see is shortness of breath, especially with attempts to exercise or activity. The accumulation of fluid causing swelling, an inability to go about your normal activities without getting out of breath or giving out, and fatigue, which of course is a very common symptom, so it's hard to sort it out sometimes, but those are the things that should alert you that maybe there's a problem.
And Mickey was making fun of me about being pregnant. Shortness of breath, I take 10 steps and I can't breathe, like seriously, but I'm pregnant. But so, you know, just because you have that symptom doesn't mean you have this. So obviously, you know, I guess do see your doctor, though. I guess should you be overly cautious in this situation?
Yeah.
If you do have a couple of these symptoms?
Exactly right. I think both shortness of breath and swelling are symptoms that are serious enough that at least it merits a conversation with your physician to make sure something else isn't going on that's more serious.
Wow. Anything else, anything your office does in particular
We have a dedicated heart failure clinic that I run and work with my nurse and my nurse practitioner, and we are try to establish a relationship where the patient is an active participant. I think this is a chronic condition, and the more actively involved the patient is, the far better the outcome. So I think that's something that we do a really good job of making it a team approach that includes the patient.
All right, folks, pay attention to your bodies, I think, is a good lesson here. Thank you, doctor, for being here. We appreciate it.
Thank you so much.
Okay, coming up.